Inspired by her participation in the Australian Rheumatism Congress in Sydney, Dr. Lourdes Manahan initiated the formation of the Philippine Rheumatism Association, or PRA. Initially, PRA is a group of 10 doctors coming from different specialties with special interests in musculoskeletal diseases.
Rheumatology started off as not just pure rheumatologists, but it was also a mix of rheumatologists with physiatrists and orthopedic surgeons.
The founding president was Dr. Lourdes Manahan. Built upon the foundation of pillars Dr. Tito Torralba, Dr. Clemente Amante, Dr. Lito Maranan, Dr. Antonio Sison, PRA as an organization and rheumatology as a discipline has gained increasing recognition through the years.
It went on into more focus on rheumatology as a discipline. Moving on into research, particularly focusing on research within the Philippine setting.
In July 2, 1996, the Philippine Rheumatism Association had been renamed as the Philippine Rheumatology Association. Each member of the PRA has contributed immensely to its growth and to the field of rheumatology. PRA has garnered a number of achievements. PRA's treasures and principles have been anchored on its founder.
She was known as the Grand Dame, so she would be La Manahan. We knew her as La Manahan, and she was really a very gentle yet stern lady of the academy. So she really came back to serve, because she was the first rheumatologist to came back and establish the practice in the country. And she was also the doctor to the Filipino.
Dr. Manahan was way ahead of her time, pioneering rheumatology practice and clinical research in the country.
She was the first to describe chikungunya fever. In fact, she also was among those who first described the genetic makeup of our ankylosing spondylitis patients. She initiated the tests for HLA-B27 during that time.
A national treasure with her lifelong dedication to healthcare and learning, Dr. Lourdes Manahan continues to serve as an inspiration to the Filipino rheumatologists. Given the complexity and chronicity of rheumatic diseases, it is innate for the rheumatologist to be a compassionate and caring physician, always making the patient's best interests central in the delivery of health care.
Rheumatology is internal medicine. A person who has a painful joint is not just worried about how his knee or ankle is bothering him. He is also worried about how it will affect his work, how he cannot play with his kids. The challenge for us as rheumatologists is to care for the totality of the person, where we put equal importance when it comes to being compassionate, not just being skilled or knowledgeable. Part of our training is being very grounded on the basics of a doctor-patient relationship. Rheumatology is a bridge between the old and the new, between tradition and innovation.
The PRA pillars have successfully mentored the new generation of rheumatologists. In one's professional journey, the doctor, as a clinician, must not lose sight of competency, dedication to excellence, compassion, and passion for service.
We are overwhelmed by a tremendous number of patients with very few number of rheumatologists. We were able to change the scenario, because a lot more people became excited when they start looking at certain diseases more difficult and need some special care. The next couple of years will be an exciting one for rheumatology, mainly because of the advantages and new findings in the field of rheumatology. I think the difficulty basically is the cost of medications.
PRA is fast gaining recognition as an interesting profession with various areas of focus. The growth of rheumatology is complemented by the newer diagnostic and prognosticating tools. The potential for expansion of the field is fueled by aggressive research and innovation. In fact, there are a lot of biologics in the pipeline. This progress in the targeted approach to treatment is most welcome given the complicated, aggressive, and progressive nature of many autoimmune diseases. The promise of newer generation medications provides glimpses of hope for rheumatic patients.
We also discovered that could somehow address the chronic problems that most of our patients have, most especially for rheumatoid arthritis, for lupus.
One of the reasons why rheumatology is gaining much interest is that there are so many new medications are now available and are in the pipeline. And I think that these medications, especially biologic agents, will really change the landscape on how we manage our patients. And I think that conducting these clinical trials is very important so that we can really determine whether these drugs are very effective and safe.
The rheumatologist is a different breed of doctor, looking out not just for the patient, but also for the family and community.
People empowerment for arthritis and lupus, or what we call as PRA. Diseases that will entail individualization of therapy, diseases that would entail support not just from the caregivers but also support from the community. Not only enhances awareness but creates the positive side of having a disease. I see the future rheumatologist as a complete, compassionate physician. I see the future rheumatologist as a leader, not just in the field of rheumatology, but a leader in the community. I see the future rheumatologist as an effective educator of young people. And the ARMS program is Applied Rheumatology Made Simple. The objective of the ARMS program is in order to create a networking between the rheumatologist and a non-rheumatologist. We have to treat the patient in a holistic manner. And every patient is going to be different. Every patient is an individual.
Cognizant of the many challenges in the delivery of healthcare, including the assessment and definitive management of patients, the PRA ensures the continuation of its legacy and the transfer of rheumatology knowledge and principles by strengthening the training of the young rheumatologists. There are 4 vibrant training institutions in the country today: the University of the Philippines, Philippine General Hospital, University of Santo Tomas Hospital, St. Luke's Medical Center, and Makati Medical Center.
The trust would be to encourage them in exposing themselves in local and international conferences.
There's just too few rheumatologists per patient here in the Philippines. There is a growing initiative within ASEAN where we are going to mutually recognize medical practitioners across the ASEAN. Another thrust as an association, of course, is to represent the rheumatologist as a physician.
APLAR is the Asia Pacific group. More than anything, it exposes us to the rest of the world. Hopefully collaborate more with each other. And then you learn things, ideas come out, and you have growth.
The World Health Organization, in fact, through the United Nations, designated the year 2000 to 2010 as the Bone and Joint Decade. In 2004, we were able to get the executive order from the President of the Philippines declaring October as the Bone and Joint Awareness Month.
A lot of the medications which we want to give are not available either because the patient cannot afford it or because there's a compliance issue or an understanding issue. Remember what is ideal while doing what is practical.
If we talk about policies, we should really push for representation in all the different organizations that have a say in trying to bring these expensive medications and make it available to the people.
Rheumatology provides patients and their caregivers an opportunity to journey through life and recovery with hope and grace. Together, let us welcome and celebrate the coming years.